Good day, sir. My name is Jones Carbonilla, and what I will be doing is the surgical hand scrubbing procedure. And let's start. The first step is collect the things needed. Soap. But what the hospital usually uses are the automatic ones, but this is the one I have available. A sponge. This is used to scrub after doing the first sepsis technique. This can also be used. A reusable one. Next is a disposable shower cap, as well as a mask. What we usually use in the OR is a four-sided one that's tied, but since I do not have one at the moment, I'm gonna just use this. And this, let's assume that this is one of those picks that's used to clean long nails. So good day, sir. So upon entry on the OR, what we should do is we should prepare ourselves a surgical cap, which is usually disposable. But I just use the shower cap, just because this is the only one available. Next is what we're going to do is what we usually use for a surgical mask are the tieable ones, as mentioned in the video, with the four-side tieable ones. But since we do not have one of those right now, what we're going to do is we're just going to use this disposable one, the normal face mask. Tie it down, secure it properly, make sure air doesn't go into your eyes. But since I'm going to be rationalizing, I'm going to just drop this down. So what we should do next is before starting, we should make sure that our sleeves are placed up. So because we are going to be washing this up to this area. So after that, at the same time, what we're also going to be doing is positioning. And what we're going to be doing is also when washing our hands, our hand position is supposed to be placed up, and water will just flow through the elbows. And when we're going to turn on the faucet, what hospitals have are the pedal ones, and they also have those knee enabled ones, and also the modern ones are the automatic ones. But for now, since we're using a faucet, here's what we're going to do. And we should also remember, once we open the faucet, we cannot retouch it again, because it will just let more organisms spread after sepsis. So what we do is once we open it on a certain level, we should just leave it as it is, and then once we're done, a nursing assistant can help and close it. So after leaving it open, do it that way. So next is we're gonna start washing our hands. The next thing that we're gonna do is we're gonna get a pick to clean our nails. After that, we dispose it. Next is what we're going to be using is a sponge. When it's usually open, it already has soap, but since in this case we just add some more. And what we do is we start scrubbing the nails first 20 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next is the fingers. We should always remember when we're going to clean the fingers, there are 4 sides of it, and each side is 15. 1, 2, 3, 4, 5, 6, 7, 8. And next is we're going to do is the dorsal and the palmar. When doing the palmars, we should also remember to scrub the weak sides. And after that, what we're going to do is we're going to start with the arms. 4 sides and each side is 10. So remember that. And then the last part is this, the forearm side. We're gonna do the same procedure on the above the elbows. 1, 2, 3, 4. Last part is always this area. Next is we go to the other side. Again, 20. Next is the fingers. Next is the dorsal and palmar sides. Again, the weak sides, should always remember to scrub the weak sides. And next is same procedure, 4 sides. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And after using the scrub, what we do is there's usually a basin where we can just dispose it. So we dispose it on this basin. And next is same procedure. Wash hand, upward. Mechanics. Remember the hand mechanics? Upward. And from there, what we usually do is we ask a nurse assistant to close the water, and what we should do is proceed to the next room.